channel, and I am here to do kind of a different video than my normal content of crafting and like reading and video games and things like that, and it's more of a serious topic. For the month of March, it is Endometriosis Awareness Month, and I just wanted to talk about it and my experiences with it because I have been suffering from it from the last possibly like 6 or 7 years now. I'm honestly not too sure how long. I've only been getting treated for it since 2019, but I've probably had it longer than that, to be honest, just based off my experience. I just wanted to talk about it with anyone else who has any issues, like suffering through any of the symptoms that I went through, just kind of like make it aware, because it's not one of those types of like diseases or disorders that is most readily known, and a lot of doctors don't tend to listen to a lot of people when they are saying that they're dealing with this. So I just wanted to bring it to light that way. If this matches with anything that you are struggling with, that it will at least start a conversation with your doctor with. But what is endometriosis? It is a condition that has endometrial cells similar to the lining of the uterus or endometrium that grow outside of the uterus. It often involves pelvic tissue and can envelop the ovaries and fallopian tubes. Also, I'll be referring to my notes throughout this, which is just right behind the camera. So if you see my eyes going up there, that's just what I'm referring to. With endometriosis, it can also affect nearby organs, including the bowel and bladder. The most common symptoms are pain and menstrual irregularities, words today, and fertility problems may also develop. I had always dealt with super painful cramping in my cycles, so I always just thought it was just related to the periods and like later on having polycystic ovarian syndrome, but based on the localization of the way my crampings were, it was a sign of having endometriosis forming. And it was so bad in 2019 when I had my first surgery. They had removed enough that was making my left fallopian tube stick to one of my intestines. So they had to remove that to unstick it, and I had so much endometriosis covering my left tube that my left tube is not usable. As a woman who has been struggling with infertility, that was kind of a blow that is still really hard to deal with. And as I'm filming this, I am waiting to get my second surgery scheduled to remove more endometriosis. So that's where I'm at currently. The endometrial-like tissue acts as endometrial tissue would. It thickens and breaks down and bleeds with every period that you have. It also involves the ovaries a lot of the time, and surrounding the tissues can be irritated and eventually will develop the scar tissue and adhesions that can cause the pelvic tissues and the organs to stick together. With the symptoms of endometriosis, the primary symptoms are pelvic pain that's often associated with the menstrual cycles, painful periods, pain during intercourse, also pain with bowel movements or urination, excessive bleeding, infertility. And if you are experiencing fatigue, diarrhea, constipation, bloating, nausea, and especially all during your menstrual cycle, that could be a sign of endometriosis. It's definitely something that you definitely need to reach out to a provider if you're feeling that can cause severe issues later on. They don't really know what the exact cause of endometriosis is. A lot of it's based on hormones. or retrograde menstruation, which is when the menstrual blood containing the endometrial cells flows back into the fallopian tubes and into the pelvic cavity instead of out of the body. And they would just continue to thicken and bleed over the course of each menstrual cycle. And a lot of the time, surgical scar inflammation can cause it, along with any immune system disorders. There are a lot of risk factors that can come with endometriosis, with it developing, like not being able to ever give birth, starting your period at an early age, going through menopause at an older age, or in a shorter menstrual cycles, like going for less than 27 days. And I myself had that issue back when I first brought up my issues to my primary care doctor in January. I had a few cycles in the month or two beforehand that they were barely like 18 days long, and I was having at least 2 periods a month. That is not normal, and that it was a sign of me having my endometriosis coming back, and had to get an appointment to have an ultrasound take a look and see about having the endometrial cells back. Usually heavy menstrual periods that last for 7 days are like some of the risk factors you can have in having higher levels of estrogen, or a greater lifetime exposure to estrogen that your body produces. And a lot of times this can be hereditary as well. So one or more relatives, like a mother, aunt, or sister, can have endometriosis and then pass it along to you. Or if you even have a disorder of the reproductive tract, like PCOS, or any medical condition that prevents the passage of blood from the body during the menstrual cycle. It usually develops over several years after the onset of menstruation, and signs and symptoms of endometriosis may temporarily improve with pregnancy and may go away completely with menopause unless you're taking estrogen. This can later on down the road cause cancer, especially ovarian cancer. It does occur at a higher than expected rate with those with endometriosis, but the overall lifetime risk of ovarian cancer is low to begin with. Usually treatment-wise for endometriosis is medication or surgery in my case. It just depends on how you and your doctor want to go about treating it. Like, you can get over-the-counter pain relievers such as ibuprofen, like Advil, Motrin, and others, or like Aleve to temporarily relieve the pain. Or you can go through hormone therapy and be put on birth control, things like that. Or there are quite a few other that are listed, or like getting set up with an IUD, things like that. The surgery that I had mentioned that I am scheduled to have a second time is a laparoscopy, where they go in through the belly button and try to remove any of the scar tissue that way. So it's not a super invasive surgery. You are under anesthesia for this, but the recovery time for me when I had it in 2019 was within about like a week and a half. I was up and moving like literally that afternoon, and the only pain I was severely affected with, it was just constipation, just the pain from that, just being on the pain medications. But other than that, I was feeling perfectly fine. I was just really bruised up after a while, but I do bruise like a banana, so it's not surprising how bruised I was. And you can get into fertility treatment when if it severely affects your fertility, like going through IVF and things like that, but that can get really pricey for IVF. And then really the only fully effective way, or the most effective treatment for endometriosis, is having a full hysterectomy with the removal of the ovaries. That will also, like, removal of the ovaries will result in menopause, so you will have the lack of hormones. That may improve endometriosis pain for some, but for others it will remain after surgery continues to cause like symptoms. And early menopause can also carry the risk of heart and blood vessel diseases, certain metabolic conditions, and early death, unfortunately. But yeah, you just have to go about finding a doctor that you feel comfortable enough and that will be really helpful and crucial to hitting endometriosis like head on. There are many celebrities that have come forward about their struggles with endometriosis, like Tia Mowry and Bindi Irwin. Especially Bindi, just recently, I think yesterday or the day before, had released a statement saying that she just had to have surgery to remove, I think, 37 lesions, some of them super deep, and she also had a chocolate cyst that they had to remove. So it affects women of many ages and of different life stages. It is definitely something not to take lightly, especially if you are suffering from these. And yeah, I definitely am not looking forward to having another surgery, but I am looking forward to having at least some minor relief. With this surgery, it only helps like every few years, and I would probably have to keep going back every few years to still remove a lot of the endometriosis, because it's barely been 4 years since my last surgery for it. So it's disheartening having to go through it again, but at least we are in a time where there is something we can do about endometriosis, but there's no like cure for it yet, unfortunately. But I hope this video was helpful for any of you who are currently going through the same thing as I am. And I do plan on doing a couple more videos just talking about the things that I'm currently going through and giving more information about that when the time comes. And yeah, please keep up to date with my video by hitting the subscribe button and like this video if it was helpful. And I'll see you guys in the next video. Bye.